My name is Dr. Justice Mbizo, an epidemiologist and public health professional at the University of West Florida. I currently serve as the chair of the Department of Public Health, where I also teach courses at the undergraduate and graduate level, both in general public health, epidemiology, in particular, infectious diseases epidemiology. I take this subject of infectious diseases very seriously, and that's why we try to do everything to promote any preventive methods or strategies against the current pandemic of COVID-19. The current vaccines that are available in the United States, I believe we have three main ones. Those have proven to be a lifesaver and a game changer in the fight against COVID-19. These vaccines that most people think were just developed overnight were actually work that has been in progress for, in some cases, 20 years, where templates have been developed by scientists who are developing these therapeutic tools to avert any kind of threats to human health. And so the current vaccines that are available in the US came out at fast speed, but they are very, very effective and they are very safe. A predominant majority of those who are getting hospitalized now are people who have not had the vaccine, or people sometimes who are in between the shots, that they got the first dose and they end up getting infected before they really develop full immunity. But the main purpose of the vaccine, for the large part, is to prevent complications, serious complications that would necessitate, for example, extended hospitalizations, or even death. So to the extent that we have seen such lower numbers of mortality, as a death from COVID-19, and for the most part, lower numbers of hospitalizations among those who are vaccinated, that actually tells us unequivocally vaccines are doing what they're intended to do. One of the mistakes I think that was made at the beginning of the pandemic, people said the younger people are not affected. But we know a lot about viruses do mutate and change from time to time, and as they do, they are the different strains are going to target different segments of the population. And when that happens, and you have such a large number of that particular segment of the population that is not vaccinated, that's precisely what you end up seeing with these strains of the Delta variant, and we now have the Delta Plus variant, and we hear of Gamma, and those kind of things. If we don't have a large population base of the population vaccinated, especially the younger people, we are going to have a problem on our hands. The younger people who are much more mobile and much likely to go into larger segments of or gatherings, places like the malls, for example. I fight with my kids about going to the mall all the time. And that's where the virus has the most opportunity to go from one person who is unvaccinated to the next person. And those encounters at the restaurants, large groups of parties, or other social gatherings, those are the prime grounds where the virus will actually find its way from one household to the next and eventually engulf most of the city or the community. And we have to do a lot among ourselves as younger people, especially, to help the community, and also help ourselves, because the longer this thing drags, means the longer we won't be able to do some of the things we want to do. Do your part. Get the vaccine. It's free, it's safe, it's effective. I got it. Together, Argos crush COVID.